Hi, I am a drug called Nefidipine, and my brand name includes our Adalat CC, Adalat, Adipine, Afinitab CR, Caractine, Fortipine, Nifedipres MR, Nifedical XL, Nifediac CC, Procardia, Procardia XL, Tensipine, Valni, and Valni XL. My chemical name is dimethyl 2,6-dimethyl-4-2-nitrophenyl-1 4-dihydropyridine-3,5-dicarboxylate. I belong to anti-anginal and anti-hypersensitive therapeutic classification. I am a calcium channel blocker. Pregnancy category is category C, which means animal reproduction studies have shown an adverse effect on the fetus and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. Whenever I am taken, I will inhibit calcium transport into myocardial and vascular smooth muscle cells, suppressing contractions, and I will dilate main coronary arteries and arterioles and inhibits coronary artery spasm, which will increase oxygen delivery to heart and decreasing frequency and severity of angina attacks. In pharmacokinetics, in absorption, about 90% of myself is absorbed rapidly from the GI tract after oral administration. However, only about 65% to 70% of it reaches the systemic circulation because of a significant first-pass effect in the liver. My therapeutic serum levels are 25 to 100 mg per ml. While in distribution, about 92% to 98% of my self-circulating is bound to plasma proteins. I am metabolized in the liver and excreted in urine and feces as inactive metabolites. I am not removed by hemodialysis and my elimination half-life is 2 to 5 hours. As an nifedipine capsule, I am medicated to treat vasospastic angina and chronic stable angina. While in extended-release tablets, I am indicated to treat vasospastic angina, chronic stable angina, and hypertension. I am contraindicated to patients with hypersensitivity to my components with cardiogenic shock and acute myocardial infarction.
The contraindications are hypersensitivity to nifedipine or its components, cardiogenic shock, and acute myocardial infarction. The side effect in central nervous system are headache, fatigue, drowsiness, dizziness, anxiety, depression, weakness, insomnia, lightheadedness, paresthesia, tinnitus, blurred vision, nervousness, tremor, and flushing. The side effects in cardiovascular system are dysrhythmias, edema, hypotension, palpitations, and tachycardia. In gastrointestinal or the GI tract are nausea, vomiting, diarrhea, gastric upset, constipation, increased LFTs, dry mouth, flatulence, and gingival hyperplasia. In genitourinary or the GU tract are nocturia and polyuria. In hematologic are bruising, bleeding, and petechiae. In the integumentary system are rash, pruritus, flushing, hair loss, Stevens-Johnson syndrome, toxic epidermal necrolysis, and exfoliative dermatitis. And in the respiratory system are dyspnea, chest congestion, nasal congestion, shortness of breath, sore throat, wheezing, and cough. And in the muscular system is muscle cramps. And now let's proceed to the adverse effects. In central nervous system are headache, dizziness, fatigue, asthenia, paresthesia, vertigo, nightmares, sleep disturbances, syncope, and confusion. In cardiovascular system are peripheral edema, chest pain, and hypotension. EENT are epistaxis, rhinitis, sore throat, and nasal congestion. In the GI tract are nausea and constipation. In GU tract are urinary frequency and erectile dysfunction. In muscular system are leg and muscle cramps, joint stiffness, and inflammation. In skin are flushing, rash, dermatitis, sweating, and urticaria.
And now, what are the nursing responsibilities about this drug? What are the nursing responsibilities before administering this drug? First, you need to monitor vital signs and cardiovascular status, especially in patients who take beta blockers or antihypertensive. Stay alert for chest pain, edema. Second, monitor fluid intake and output and daily weight. Fluid retention may lead to heart failure. Also, assess for the sign of heart failure such as crackles, dyspnea, jugular vein detention, peripheral edema, and weight gain. Third, watch for the rash. What should the nurse do during the administration of the drug? First, for closely monitored hospitalized patient with angina, dosage may be increased 10 mg every 4 to 6 hours to control chest pain. Second, if patient is kept on nitrate therapy while nifedipine dosage is being adjusted, urge continue compliance. Patient may take SL nitroglycerin as needed for acute chest pain. Third, inform patient that angina attack may occur 30 minutes after a dose. Explain that these attacks are usually temporary and do not mean that the drug should be withdrawn. Fourth, urge patient to take nifedipine exactly as prescribed, even when feeling well. Fifth, reassure patient taking the extended release tablet that the wax mold may be passed in the stools. Assure patient that drug has already been completely absorbed. And what are the nursing responsibilities after administering the drug or the patient teaching? First, tell patient he may take immediate release form with or without meals. If GI upset occurs, tell him to take it with meals, but never with grapefruit or grapefruit juice. Second, caution patient to not crush or break extended release tablets. Tell him to swallow them whole. Third, patient to report rash immediately. Fourth, caution patient to avoid driving and other hazardous activities until he knows how the drug affects concentration, balance, and alertness. Fifth, instruct patient to consult prescriber before taking herbs or over-the-counter drugs, especially cold remedies. Sixth, teach patient to measure pulse rate and blood pressure and advise to call prescriber if they drop below accepted levels. Seventh and last, advise patient to avoid prolonged sun exposure and to wear sunscreen outdoors.